So when I have people come into my practice, we'll often have a discussion of what does proper breathing look like and what does not so great breathing look like, right? And I'll often kind of categorize this into two things. We have our sympathetic breath, which is going to be typically reserved for our fight or flight, right? In primitive times, if we were like running from a predator, it's those really short breaths where we're raising and lowering our chest and breathing a lot up here. We're getting our accessory muscles to activate, so neck muscles, shoulder, all of that, creating a lot of tension here. But we're just trying to get those short, shallow breaths so that we can run away from whatever we're running from, right? On the other hand, we have our parasympathetic breath, and this is our rest and digest. And this is when our body can kind of come back to a relaxed state. We have homeostasis. And this is when we are using that full lung field and really getting a breath through here. So I encourage you to join with me in this breathing practice today. We're just going to kind of assess how are we breathing on a day-to-day basis and how do we start to change those patterns. So if you come along with me, we're going to lay on our back to start. And then what I'll have you do is you're going to take one hand, place it on your chest. The other hand is going to go onto your abdomen. And then from here, we're just going to take some breaths naturally. Breathe in and out. And as you're breathing, I want you to just take note, what is happening to our hands, right? Is one hand moving more than the other? Is my upper hand moving up and down towards my head? Is it moving up and down towards the ceiling? Am I getting any motion on my lower hand at all? If you find that you're getting a lot of shoulder motion, things are moving up and down up here, you might be what we consider a sympathetic breather. And a lot of that is related to the fact that, as mentioned, we're sitting in chairs oftentimes, so we're not recruiting as much of our deep core musculature as we need to. We're not utilizing that deep diaphragmatic breath. And also, today's state is often one that is very anxious. We have a lot going on. We're stressed out all the time. So we'll start to fall into this pattern more. So if that's what's happening to you, what I want you to do, or if you're a great breather anyways, we're gonna move on to working on more efficient breathing style. And what I want you to think about is creating space down here. So as you inhale through your nose, let all your breath come deep into your abdomen, fill your lungs up, diaphragm should press down, and then we're creating some space and pressure down here. And exhale. If you're having a hard time bringing your breath into here, what I like to tell people is either take your hand and press down a decent amount so that you have a little bit of external feedback to resist with. So if you're pressing down, you want to resist that pressure of your hand with your breath. Or you can actually take a weighted object, which is something I'll use as a cue for some people. They just tend to understand the task a little bit better. So again, pressure here, breathe in. Push that hand up and exhale. Good, breathe in. Exhale. And in. Exhale. If you're still struggling with adding a weight or adding pressure with your hand, another option is to get your legs up on something. I'm gonna grab a ball. So another option is to get your legs up on a chair or the couch or your bed, and this will just get us in a more closed position so that we might be able to understand how to bring the breath lower down. So I always tell people, almost think about inhaling so that your belly is going to press into your thighs. So again, inhale, exhale. Just as a reminder, you want to make sure those breaths are slow and steady. I'll usually encourage like a 3 to 6 count. And if you want, you can almost test yourself to increase the amount of time you're inhaling and exhaling the more you practice. So my recommendation to start is about 5 minutes a day minimum. This is a breathing exercise. You can literally do as much as you want, as much as time will allow. There's no dangerous side effects to this or anything. You're gonna notice that we're probably feeling a little bit better physically. We're also gonna have a little bit of decrease in stress, decreased blood pressure, so on and so forth, decreased heart rate. So if not only the physical benefits, also some emotional and mental benefits. So try that out to start and continue to follow along, and we're going to be sharing some more tips moving forward.